Well, the march comes obviously after the finding by the Special Investigating Unit in their interim report that 2 billion rand was stolen from Tembisa Hospital by 3 separate syndicates. Dr Aslam Dasoo is the convener of the Progressive Health Forum. Dr Dasoo, good afternoon to you, and thank you very much indeed for your time. We've seen what's happened at Tembisa Hospital. Do you believe that other hospitals in Gauteng are vulnerable to the same kind of corruption?
Good afternoon, Stephen. Very good to be with you. Short answer is yes. What you're finding in the Tembisa situation is emblematic of how the entire system runs. And even by the, it's quite a shocking thing what we've seen, but even by the astounding standards of corruption that we find in this country, the Tembisa hospital heist is, it's shocking. That a hospital could be used to siphon funds way in excess of its total annual budget 3 times over by syndicates. And that was picked up, a whistleblower was assassinated, and I'm sure that chilled anyone else in the administration, and certainly curbed their enthusiasm to whistleblow again. I was watching, if I may just say, I was watching the excerpt before, and I'm very pleased that Nehawu has taken the step to march to the MEC's office for the reasons that were described. But I was less impressed with the last point, that, the problem doesn't only lie with the lower level staff, it lies with higher level staff at hospitals and at head office, but that's as far as Nehawu will go. It would appear to me that when you watch that SIU report back, and you have the minister there and the MEC there, smiling. I mean, that is the truly astonishing bit, that the MEC is in place. With this happening, it is not possible that this is a conspiracy just of a few civil servants. There is political enablement here, and this has been going on for decades. And so, sorry, I did say it would be a short answer, and it is yes, this is across the province, and I'm sure it is similar in many, many other provinces.
So, I mean, I was going to ask you if you believe that the MEC, Nomanto and Komoralahoko, would be able to fix this, but you make such a strong point about political enablement here. Do we need a comprehensive change in the health department? And I do mean, let me put it to you another way, do you believe the MEC can stay in her position?
Absolutely not. Given the serial disasters she has overseen. I mean, you'll recall there was a video by this gentleman, Tom London, when he was a patient at Helen Joseph, which caused a huge controversy, led to the Ombuds investigation, which came out with scathing findings. And yet, the MEC and the Premier spent time with Tom London, 2 hours, commiserating with him and blaming health workers. And to date, as the Ombuds report shows, nothing was done. Now, with the Tembisa Hospital thing, this has been going on for several years. Your journalist colleague, Jeff Wicks, has actually written a book about his investigations into this. The SIU presumably will get to that point. But when you think about how the infrastructure management is going on. When the fire occurred at Charlotte Maxeke Hospital during COVID, effectively crippling that hospital, it took a year and there were no reports on what was going to happen. We did a PIA application and then an appeal because we got no response. And what came through was quite astounding. Only one party respondent, that was South African Police Services. They furnished us with their expert forensic report, and it is a truly expert report, which demonstrated that this was deliberate arson, and it was very well planned, using terminology like direction of blaze and use of accelerants, and meant to cripple the hospital. The reason I'm saying this, because even the Nehawu person who mentioned the Department of Infrastructure Development, that department came out 3 weeks after the fire saying it will cost 1.7 billion and will take until 2027 to fix it. They had no money. They went to the Solidarity Fund, that is the Department of Health, which agreed to support them. but they would want their own assessment, which showed that it would take 600 million rand and 6 months to get to 80% refurbishment. So what was the other billion for? This was an extraction project. So the corruption is deep, it's systemic, and it goes right through the system. And it's a real shame because until you change the entire governance of provincial health services and presumably other departments, you are not going to get anywhere in terms of trying to resolve this problem. The governance change has to be deep and has to be proper. We have to remove or put an iron wall between politicians and the management of provincial budgets for healthcare, which are the most routinely plundered in the country.
We're talking about Gauteng, and obviously Tembisa Hospital is in Gauteng. But do you think the same thing is happening in other health departments? I mean, every health department will have its own different story. Each province is different. But are other provinces vulnerable to the same kind of thing?
Of course they are, all of them. We know that the Western Cape does better on those scores, but it's not completely immune from this, okay? Take Free State, for example. It had a well-functioning public health system for the first few years of our democracy. When Ace Magashule became premier, things started to move in a very different direction. And today, what we have is a health department that's broken in all measurable metrics. It's broken. And you begin to wonder, if it takes good leadership, and we expect MECs to provide that, if it takes good leadership in order to make sure the system works, that corruption is minimized and so on, then one has regard for the article of faith of the governing party, the ANC, in that province, which says that leaders must be appointed after the test of the eye of the needle, being able to pass through that. Well, when the eye of the needle is as wide as the barn door at Estina Dairy Farm in that province, you begin to understand the level of leadership that exists.
Dr. Aslam Dasoo, thank you very much indeed. The convener of the Progressive Health Forum, I really do appreciate the time.